The issue that we're trying to solve or make better is sexual dysfunction, and more women have problems with that than men, and there are a lot more solutions for men than there are for women up till this point. About 40% of women have some sort of a sexual dysfunction. About a quarter of women have either trouble lubricating or they're not enjoying the sex that they're having. About 25% of women are unable to climax or have orgasms. About 20% of women have painful sex, and about a third of women lack interest in sex altogether. So we're trying to improve that situation. You've got Viagra and you've got pumps for men, but there aren't a lot of things really that women have access to. So this new technology is something that will improve the ability to have sexual orgasms. The way it works is men have the glans penis, and then they have the base of the penis. We have a clitoris and a G-spot. And just like the penis, this is all connected in us. The G-spot is inside, the clitoris is outside, but that whole area is climax territory. And so studies have shown that women who have a thicker vaginal wall, the front of the wall closest to the belly, have a better ability to have intercourse orgasms. And so someone got really smart and thought, okay, if we thicken that somehow, we can improve that. And they have done that. The G-spot enhancement has been done for quite some time. And they use products like hyaluronic acid or calcium hydroxyapatite. But there could be problems with those things because those are foreign materials to the body. You can get granulomas around the injectable injections the product that's injected. And so it's not something that I would feel comfortable doing inside of my body. So the platelet-rich plasma, that is a concept that's been used for a lot of time in medicine, especially in orthopedics and in dentistry. Platelets in your blood, those are the cells that are involved in the clotting cascade. They don't have a cell, but they have lots of things. They don't have a nucleus, but they have lots of things within the cell called growth factors. And you have vascular growth factors, you have tissue growth factors. And what happens is when these platelets get into an area that needs healing, for example, there's a lot more blood flow, and the platelets release their growth factors and help heal the tissue. So we can take blood, we can spin it down, we can get platelet-enriched plasma, which doesn't have the red blood cells, and we can inject that into tissue. I've had it injected in my foot. I have a joint in my foot that's really bad. I've had that injected several times, and that has been the most much more helpful than steroids, which actually destroy tissue, because it helps build whatever tissue it's injected into. So in the joint, it helps build the cartilage on the edges of the bone. When you put it in the face, we use it for facial enhancement, it improves the texture of the skin and it turns on the fibroblasts so that you can make more skin. If you inject this into the wall of the vagina, it makes that wall thicker, which then increases your ability to have orgasm when you're having sex. The way it works with women and sex is that we have to have other conditions sort of going well. Sex to us is not a requirement, it's a luxury. And so your life has to be going okay. And if you have a lot of stress in your life, probably the first area it's going to hit is your sex life. Because if you're tired, exhausted, worried about the kids, worried about your husband, worried about whether or not your job is going to be around in another month, you're not going to have a lot of energy or desire to have sex. So probably the number one thing you've got to solve first is having a healthy environment, a healthy relationship, someone that you actually care about. And with that, then you need to have your hormones at the right levels. And so younger women have better libidos than older women. Once you hit 35, 40, especially if you're taking care of kids and you're really busy and working and taking care of home, you don't quite have enough testosterone to give you that push to have sex. So one of the things that we always look for is to make sure that your hormones are balanced and that you have enough of the ingredient to make your brain want to have sex. So we make sure that your testosterone levels are good, which means we may need to give you some cream or an injection or a pellet. So that's the first thing. And then also, if we have your hormones balanced, you're going to feel better, and you're going to have more positive outlook on life, you'll have more energy, so that's really a requirement. And that includes checking your thyroid and your adrenals as well. So it's the whole thing works together. So we need to make sure that your body is working properly.